Welcome to my YouTube channel.
Imagine a child who struggles to run with friends, feels tired all the time, and avoids mirrors because of how they look. This is not a rare story anymore. Today, childhood obesity has become one of the most serious and fastest-growing health problems in the world. What was once considered an adult issue is now affecting millions of children, silently damaging their bodies, confidence, and future. Childhood obesity is not just about weight. It is about health, happiness, and survival. If we ignore it, obese children are likely to become obese adults, facing heart disease, diabetes, and a shorter lifespan. But the good news is this: childhood obesity is preventable and treatable, especially when action is taken early. Let us understand what childhood obesity really is, why it is happening, and most importantly, how we can prevent and treat it. Childhood obesity means a child has excessive body fat that increases the risk of serious health problems. Doctors usually measure this using body mass index, or BMI, adjusted for age and gender. When a child's BMI is above the healthy range, it becomes a warning sign that the body is under stress. The causes of childhood obesity are complex. It is not caused by one single factor. Unhealthy eating habits play a major role. Many children consume large amounts of fast food, sugary drinks, packaged snacks, and ultra-processed foods every day. These foods are high in calories, but low in nutrients, leaving children overfed yet undernourished. Another major cause is lack of physical activity. Today's children are growing up in a digital world. Hours are spent watching television, scrolling on mobile phones, or playing video games. Outdoor play is slowly disappearing, and many children do not get the daily movement their growing bodies need. Genetics also influence obesity. If parents are overweight, children may have a higher risk. But genetics alone do not cause obesity. Environment and lifestyle choices are the real drivers behind the rising numbers. Emotional factors also matter. Stress, loneliness, family conflict, academic pressure, and even bullying can push children toward emotional eating. Food becomes comfort, not fuel. Over time, this habit can lead to unhealthy weight gain. Socioeconomic factors cannot be ignored. Families with limited income may have less access to healthy foods or safe spaces for physical activity. Cheap, processed foods often replace fresh and nutritious meals, increasing the risk of obesity. The health consequences of childhood obesity are serious and long-lasting. Obese children are more likely to develop type 2 diabetes, high blood pressure, high cholesterol, and fatty liver disease. These conditions were once seen only in adults, but now they are appearing in children as young as 8 or 9. Breathing problems such as asthma and sleep apnea are also common. Extra weight puts stress on joints and bones, causing pain and limiting movement. Obesity can even affect puberty and hormonal balance. The emotional impact is just as damaging. Obese children often face teasing, bullying, and social isolation. This can lead to low self-esteem, anxiety, depression, and poor academic performance. Some children stop participating in school activities or sports because they feel ashamed of their bodies. If childhood obesity continues into adulthood, the risks become even greater. Heart disease, stroke, certain cancers, and early death become real threats. That is why prevention is not optional, it is essential. Prevention of childhood obesity should start early, even before birth. Healthy pregnancy, balanced maternal nutrition, and avoiding excessive weight gain during pregnancy reduce the risk of obesity in children. Breastfeeding has also been shown to protect against childhood obesity, and should be encouraged whenever possible. As children grow, healthy eating habits must be developed. Meals should include fruits, vegetables, whole grains, lean proteins, and healthy fats. Sugary drinks, sodas, and fruit juices should be replaced with water or milk. Fast food and processed snacks should be limited, not banned, but kept as occasional treats rather than daily habits. Parents play a powerful role. Children learn by watching. When parents eat healthy foods and enjoy physical activity, children naturally follow. Family meals help control portions and encourage better food choices. Physical activity is a key pillar of prevention. Children should be physically active for at least 60 minutes every day. This does not mean gym workouts. Running, cycling, swimming, dancing, playing football, or even active household chores all count. Reducing screen time is critical. Excessive screen use is strongly linked to obesity. Replacing screen time with outdoor play or active hobbies can transform a child's health. Sleep is another often ignored factor. Lack of sleep disrupts hormones that control hunger and fullness, leading to overeating. Children need regular sleep routines and enough rest based on their age. Schools also have a major role in preventing obesity. Nutritious school meals, daily physical education, and health education programs can shape lifelong habits. Schools should be safe spaces that promote movement, not punishment. Now let us talk about treatment. When a child is already overweight or obese, the focus should not be on rapid weight loss. The goal is healthy growth, improved habits, and better overall health. Lifestyle change is the foundation of treatment. This includes balanced nutrition, regular physical activity, limited screen time, and healthy sleep patterns. Small changes, such as replacing sugary drinks with water or adding a daily walk, can make a big difference over time. Treatment must always involve the family. Children cannot change their environment alone. When the entire household adopts healthier habits, success becomes possible. Support, encouragement, and patience are far more effective than criticism. Medical evaluation is important. Doctors can assess the child's growth, identify related health problems, and monitor progress. In some cases, support from dietitians, psychologists, or obesity specialists may be needed. Medications are rarely used in children, and only in severe cases under strict medical supervision. Surgery is considered only for older adolescents with extreme obesity and serious health complications, and only when all other treatments have failed. One of the most important parts of treatment is protecting a child's mental health. Weight stigma and body shaming can cause lasting emotional harm. Children should never be blamed for their weight. Obesity is a health condition, not a moral failure. Encouraging self-confidence, resilience, and body positivity helps children stay motivated and emotionally strong during their health journey. Communities and governments also play a role. Safe parks, walking paths, affordable healthy foods, and restrictions on junk food marketing to children are powerful tools in fighting childhood obesity. In conclusion, childhood obesity is a serious but preventable and treatable condition. It threatens not only physical health, but emotional well-being and future quality of life. The earlier we act, the better the outcome. By promoting healthy eating, daily physical activity, adequate sleep, emotional support, and family involvement, we can protect our children from the dangers of obesity. Every child deserves a healthy body, a confident mind, and a future free from preventable disease.